And hello, everybody, and welcome to the Social Justice Forums. I am Daren, Jaime, and of course, we thank you for joining us. If anybody asked the question, what exactly is this show all about? Well, we take a look at the inequities that a lot of people face. We promote civic engagement. We get questions answered. And at the same time, we're bringing people who are very informative with some insight and some information and some great dialogue. So we invite you to stay connected with us. The Social Justice Forums begins right now. Welcome back to the show. Well, as we start off, in New York, African Americans account for about 37% of those living with HIV, despite only accounting for about 14% of the total population. As we recognize the work that's being done for Black Americans, Governor Hochul is persisting with a move that's actually exacerbating health inequities and making it harder to end the epidemic in New York's Black community. This is according to some people. And joining us now is the Senior Director of Public Policy and Advocacy for Callen-Lorde Community Health Center. And we've got Kimberleigh Joy Smith. And thank you so much for being with us.
Thank you for having me.
So thank you. And, having this conversation is very important. We talk about those statistics and somebody may say, well, that's not too bad. But the reality is those numbers are quite telling.
They are. I mean, we're seeing a lot of progress with HIV and in terms of ending the HIV epidemic here in New York and across the country, really. In 2019, actually, here in New York, we were able to bend the curve. And what that means is that we were able to see a decrease in HIV prevalence for the first time. And so we celebrate that. However, what we're also seeing more recently is, first of all, the COVID-19 pandemic really did sort of suppress uptake of PrEP, which is pre-exposure prophylaxis. It suppressed HIV testing, and it really sort of curtailed people being engaged in care. So this is concerning. And what we're seeing from the latest data is that even though overall we're seeing progress with HIV, there are still some very persistent and vexing disparities that exist among people living with HIV, and particularly that are impacting Black people who are living with HIV, transgender folks, and young men who have sex with men. And in fact, in that most recent data, what we're seeing is that the rate of new HIV infections among non-Hispanic Blacks is 7.4 times higher than the rate among non-Hispanic whites. So clearly, despite overall progress that's being made in terms of ending the HIV epidemic, we still have a lot of work to do.
Let's talk about New York State for a minute. Governor Hochul has really come out and she's talked about some initiatives and some things. Talk to me about how you view the governor's approach and what's happening with regards to HIV and AIDS.
Well, the governor has supported our campaign to end the HIV epidemic, and she has put her money where her mouth is and dedicated resources to ending the epidemic, and for that we are very grateful. However, she is also persisting with what we think is an ill-advised plan that will disrupt or threaten our efforts to end the epidemic. What she's proposing is to move the Medicaid pharmacy benefit from managed care to fee-for-service. And this may not seem like a big deal or kind of wonky, but what that is doing is, what that's going to do actually is disrupt access to a federal stream of funding called 340B. 340B is the actual federal drug discount program. And by making this policy change, she's disrupting community-based healthcare clinics like Callen-Lorde and many across the state. She's sort of stopping our ability to get that revenue savings. And what we've been able to do in New York, is sort of really build a robust healthcare safety net. And that, I think, is why we can say we've made so much progress in ending the epidemic to date. And that, this safety net is community-based healthcare clinics like Callen-Lorde, but it's also Ryan White care programs and other community-based organizations and social service organizations. And we've been able to invest resources in these programs and in the safety net to support, advancing an end to HIV and advancing health equity and health justice. But this policy change is going to siphon away millions upon millions of dollars from the community-based healthcare safety net, and then, threaten this progress that we've made.
If we're talking government for a moment, obviously the governor has her plans, and then she rolls them out, and then guess what? You get a lot of local elected officials, community-based organizations, people such as yourself who are actually raising their voice and saying, hey, appreciate the effort, but this really is doing some damage. What's been the feedback in your community against the governor's proposal, and what support have you gotten from other maybe local electeds who are trying to feel the plight of this too?
Yeah, I mean, we've got a lot of great feedback. We are working very hard. Callen-Lorde is a part of a larger network and coalition called Save New York Safety Net. And this is a statewide coalition of safety net providers, community-based healthcare clinics, like I spoke about, the Ryan White Care programs, and even some HIV special needs plans. And so we as a network are pushing very hard for the governor and the legislature to not put this policy in place. The policy, if it goes forward, is set to go forward on April 1st. And so we're really asking the legislature at this point and the governor to stop and to take under consideration an alternative that we have come up with. And this alternative would leave that 340B mechanism in place. It preserves net. We actually think it will save the state money, and it will avert all this disruption that we fear is going to happen for our patients and communities across the state. So the feedback has been good, but we still have a lot of work to do. We're actually asking assembly members in particular across New York State to really stand up in conference next week and support the carve-out compromise that our coalition has put together. So we've had some initial support from the Assembly Health Chair, Amy Paulin, and the Senate Health Chair, Gustavo Rivera. They are vetting our compromise, but they really need to hear from their members that they are in support of this compromise legislation. So that's kind of where we are now. We're still sort of building support and hoping that we can stop the carve-out from happening and keep up the progress to end the HIV epidemic and continue to support people living with HIV as well as prevent HIV from happening.
Can you give me your assessment post-COVID? I mean, we want to say post-COVID because we're still dealing with it, right? But
Right.
in the heyday of COVID, we understood that a lot of communities were overlooked. Those, particularly the HIV and AIDS community, had a lot to contend with during the COVID crisis. Talk to us now about where we are. Also, being destigmatized, right? So many people were up in arms, or not even up in arms, but had so many misnomers when it came to HIV and AIDS. But talk to us about the destigmatization of, and what do you feel, where do we feel, I should say, we are right about now?
Yeah, stigma is still very much an issue for our people living with HIV and impacted by HIV, and certainly for our Black and Brown communities. And it's something, unfortunately, that didn't, get eradicated with the COVID-19 pandemic. I mean, I said earlier that the COVID-19 pandemic really kind of exacerbated barriers to HIV prevention and care, and it really did sort of suppress folks from being able to go seek preventive treatments, from going to get HIV testing, and then ultimately prevented them or suppressed sort of their connection to care. And this is not, obviously not good. And we actually saw a little bit of an uptick in terms of new HIV diagnosis here in New York City. And so that, we're still sort of working our way out of that. But stigma also remains, a big issue for our communities. We want folks to, get affirming health care, to take care of their sexual health. And sometimes, that can be difficult in communities that you might fear discrimination, you fear stigma for various reasons. And so it's something that we are still confronting, and have been confronting throughout the pandemic and now moving forward.
Lost mute right there for a second, but I want to take a moment and just have you share a little bit about testing, right? Because I think that's still important. And I know a lot of people sometimes have an aversion to it. From your expertise, are we seeing more and more people engaging in testing and taking advantage of the resources that are out there?
I mean, I think overall, more and more folks are. Again, the pandemic did kind of put a damper on that a bit, but I think we're getting the word out in the community that testing is very important, and it's part of something that you should do to take care of yourself and your health. We sort of policy-wise have been inching toward making testing something that's routine for folks, and so that when you go to the doctor, that's just a part of your routine medical care. And so, I think again we're making progress, but there's still a lot of work to do. And unfortunately, the progress that we are seeing with ending the epidemic has not been sort of equally felt across all communities, and that's where we really need to kind of double down and focus our efforts on to make sure that we can end HIV for all and not just sort of one group or a couple of groups.
We're coming off the opportunity for awareness, and during every year, HIV, about AIDS, about stigmas, about things that people need to know. What are you hearing from people as you continue to go out and share your message?
Well, I think people, there's a little bit of complacency, and this is not entirely new. And then, COVID-19, that pandemic hit, and I think that probably didn't help matters. So HIV is maybe not as in the forefront of everyone's minds as it might have been in prior years. However, then, whenever you turn on your TV, you might see an ad for a pre-exposure prophylaxis medication, and you see affirming outreach to folks, encouraging them to take care of themselves and investigate different prevention options and treatment options. And so that is a good thing. But I think what we need to do is kind of continue to try to accelerate the ending the epidemic efforts, continue to invest resources, and really push our elected officials to, create policies and support policies that invest in our healthcare safety net, like the, like investing in the community-based healthcare centers like Callen-Lorde and others, and not doing policies like the Medicaid pharmacy drug benefit carve out. Those policies take away from the healthcare safety net and disrupt the healthcare safety net, and will be devastating to many, many thousands, maybe millions of patients across New York State.
You talked about the governor's plan. Talk to me about where it is right now, and where will it be going over the course of the next month or so?
Great question. Well, where it is right now is that the plan is set to take effect April 1st of 2023. That's just a few weeks away. The governor did indicate in her budget briefing book that she plans to move the Medicaid pharmacy benefit from managed care to fee-for-service and siphon away this money. They have indicated, the state has indicated that they have a plan to reinvest a pool of money that they think will make up for the money community-based healthcare clinics like Callen-Lorde will lose. We believe that plan is not sufficient. And furthermore, we don't have a lot of details about how we will see that revenue. And April 1st is right around the corner. We have a lot of concerns that the mechanism is not going to be in place, and that patients' care is going to be very seriously disrupted. So that's where the plan is. It's a sort of vague plan, I guess, that's not even written in the statutory language of the budget, but you know, we're hearing information from the state that they have this reinvestment plan that we think is very seriously uh, not sufficient, and we're hoping that they will really take under consideration our compromise proposal, which, as I mentioned, will not disrupt the safety net and you know, keep folks in the care that they deserve.
Knowing the potential ramifications, how can the public actually play a part in raising their voice and supporting this effort?
That's an excellent question. I would suggest at this point that the public, if you know or can figure out who your state assembly person is, or state senator for that matter as well, to call upon them and ask them to support 340B and to support the compromise bill as opposed to the Medicaid pharmacy benefit carve out.
And right now, we know that you know, we're just starting 2023, and we're still in the initial months. But can you give us a little bit of a forecast as to the work that you'll be doing throughout the course of this next year?
Well, we're going to continue serving people and providing affirming quality healthcare. The clinic that I work for is a federally qualified healthcare center. We serve LGBTQ communities, but are open to all regardless of ability to pay. So we're going to continue to provide all the sort of competent healthcare that we can, and all of those sort of wraparound services that help folks get engaged in care and stay in care. We'll continue to provide quality sexual health programming, HIV testing, and just really doing all that we can to make sure we meet the needs of our communities.
Well, Kimberleigh, it's been a joy having you, and thank you for the work that you're doing. Thank you for giving us some clarity as to a little bit about 340 and what this really means. I think it's important that the public knows what's coming down the pike potentially, and also what they can do in order to raise their voice. So thank you for being a great voice and a great advocate, and being with us here on the Social Justice Forum.
All right, appreciate the time. Thank you.
All righty, well, we want to thank Kimberleigh J. Smith for being with us, and guess what? We're taking a quick break. We'll be back more here on the Social Justice Forum.
Is it time yet?
It's time.
Come start time for dinner.
Oh, terrific.
Pasta dinner.
Donating pet food is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
Most hiring algorithms would scream me out.
Some bosses couldn't see me as a leader.
I've run this place for 20 years, but I still need to prove that I'm more than what you see on paper.
I've been writing code as long as I've been able to reach a keyboard.
This is what I do. It's second nature for me, coordinating 100 details at once.
It's the way my mind works. I have a very mechanical brain.
I sold them on my skills.
You gotta be so good they can't ignore you.
My magic is
Analytics and empathy. That's how I'm getting clients. You have to have the confidence in yourself to show up and defy the odds.
I'm more than who I am on paper.
I never got a college degree. And today, I'm the CEO of my own company. People want to tell me I'm one in a million, when actually I'm one of millions. Stars are all around us. It's time for them to shine.
STEM is everywhere. Like here,
behind the scenes of The Walking Dead.
When we break down clothes, we tumble it with trisodium phosphate, rock salt, and dish detergent.
We stitched together images of our model and created a 3D set that could be walked through in a VR headset.
We're able to turn 12 walkers into 1,000 walker horde.
STEM can create new worlds on and off the screen. What will you make with STEM? Get inspired at shecanstem.com.
Even though we didn't grow up together, he's my favorite brother.
Hey, sis.
I'm the baby of the family, and he's the gentle giant.
What you know about Port Georgia?
Man, please, that's a classic.
You know when they say people are a rare breed? Yeah, he's that.
I'm sorry, I'll be back in a few hours.
Don't worry, Shug, you know I'm for you.
I know.
Go get the football.
That was my favorite memory. He was always for ya. This is a true story of me, Bridget Floyd, and this guy, George Perry Floyd Jr., my big brother.
Man, it's lonely. Like, going through life lonely.
There is the therapeutic aspect of music, just expressing how you feel. I'm going to talk to Howie about his feelings, make it into a song.
When we talk about this issue, it is one that wages on the hearts and minds of so many American people. Workplace fairness. And Workplace Fairness is a not-for-profit organization that's working to actually preserve and promote employees' rights. Now, the organization believes the fair treatment for workers is sound public policy, as well as good public practice and free access to comprehensive, unbiased information about workers' rights without legal jargon. That's an essential ingredient in any fair workplace. And joining us now, we're pleased to have the Executive Director for Workplace Fairness, Edgar Jatu. And Edgar, glad to have you with us.
Thank you for having me, Daren.
Thank you. And I want to talk really about laws. I mean, right now we are talking about a new law that just on another platform, about a new law that allows for employers to have to put up your salary here, and how that's going to help out in the negotiation process and workplace fairness, and how that really creates some sort of better traction for an employee, particularly in the area of negotiation. Things like this, I know your organization is front and center on.
Yes, absolutely. We definitely believe that it's important for employees to know the salary requirements of their jobs, and particularly in Women's History Month, and looking at the gender pay gap, it would really help certain types of employees, such as women, be able to negotiate fair salaries for work that they want to do at various employers.
Yeah. When we talk about discrimination, we know that it occurs in the workplace more prevalently, and it's more and more prevalent. How do you gauge in terms of discrimination in the workplace? Are we seeing things get better, or are we seeing things get worse?
That's a good question, Daren. I would say that while a lot of employers are getting a lot better about creating more fair workplaces, COVID in the past couple of years have shown that discrimination is still a very prevalent problem in the workplace. We've uncovered, and in many regards, that if anything, the pandemic has shown how bad it could be. When people have to make some difficult decisions around employment. And so, again, just looking at the way that women are treated in the workplace, there's still a lot of room for improvement, particularly around the way women have been impacted in terms of, having to balance home and work and caregiving responsibilities, and a lot of employers not being sensitive to those needs. When we look at the way people who are disabled have been treated over the past couple of years, particularly those who have contracted COVID or are immunocompromised and have fears about going back into workplaces, particularly employers that are not being mindful of COVID precautions, and making sure that their workplaces are safe, particularly those who are immunocompromised, and even around race discrimination, right? And that's still an issue. And again, some employers, or a lot of employers, are looking to make changes in the way they recruit and retain a diverse workforce, but there's still a lot of room to go.
Yeah. When we talk about trying to really address the issue of workplace discrimination, it's a hard uphill climb for a lot of people because you have that threshold of actually having to prove it. And give us a little bit more, because when we talk about proving workplace discrimination, how do you go about documenting to get to that place? Because so many people have legitimate cases, but can't really reach the threshold to get some affirmative action on their behalf.
Yeah, I would say the most important thing is to be vigilant of your surroundings and what is said to you and what's being done to you. And here's the thing, many employers or bad actors are not going to blatantly do something discriminatory, right? Sinisterly, a lot of people have gotten smarter about the fact that they can't just use certain words in the workplace or overtly do certain things to make it known to you that they're discriminating against you, right? It often comes in the forms of subtle acts or things you just don't see, right? But the good news is that many cases these days are what we call circumstantial, that you don't have direct evidence, but if you look at all the clues around you, you can make a circumstantial case for discrimination. So my advice to people is that the minute you believe that something is not going well with your employer, I think it's always a good idea to start documenting your experiences and start creating some sort of journal narrative that you maintain. And you can do that. You can do that in a notebook. You can do a memo to a file to yourself and email yourself notes about things people say to you, things that have been done to you, how other people in your similar situation are being treated. So, if, for example, you are a secretary and you're a Black female secretary, you know the other secretaries around you that do the same work and work for the same person look different than you, then you want to document that, okay, today I got yelled at for taking a lunch break, but these other folks who also left at the same time I did not, and they look different than me, right? These are things you want to start documenting and take a note of, because if it comes to a point where you suffer a true, what we call an adverse employment action, so maybe you're docked pay for something unfairly, or you get a bad performance review where you felt was unfair, or you get suspended, something where you lose money or you lose some sort of material status in your employment, then you might have a case, right? But I find that a lot of times people don't do the work to take account as to things that are happening to them over time, because you'll be surprised what things you might help an attorney put together if you're keeping track of all the bad things that happen to you at work, and also making sure you're keeping track of all the documents. So any notices you receive, any paperwork. Now, I'm not saying that you should keep to yourself proprietary information. That's something you don't want to do. But if it's things that you would normally receive in the course of your business, those are things you want to keep for yourself, to ensure that you have some sort of evidence to show that that I'm being discriminated against.
A lot of people will say, listen, when it comes to discrimination or feeling unfairly treated at work, they recognize it. You've got coworkers who recognize it. You've got, somebody that you can say, hey, have you witnessed this? Yeah, I saw this. I saw this. But when it comes to coming forward, a lot of people sometimes will refrain from coming forward simply because of one thing: retaliation.
Right.
They want to keep their job. And I don't want to say too much because I really need this job, and if I lose this job, or I might be treated even more harshly, or somebody that I love or somebody that I'm connected to might have to go through something. So we know that there's some other actions that have been taking place legally to really deal against retaliation and whistleblower policy. So can you bring us up to speed with the latest laws that deal with whistleblower policy, but also speak to, number one, that whole thing about retaliation?
Sure. So I'll start with retaliation. So, you know, I always tell people that one of the hardest things to do is to file a lawsuit against your employer because for that reason of retaliation. And it's a very scary prospect that an employer might decide to take certain action against you, which could be as worse, it could be as bad as you being terminated because you filed a lawsuit against them that you believe strongly about. So I do recognize that, and I always tell people it's a important decision you have to make, right? And it involves your family, it involves your bank account, of course, because losing a job or being demoted or having to pay for an attorney is very costly. So I say this to echo the fact that it's a very important decision to make. Now, on the topic of being a whistleblower, so being a whistleblower is a little different than our conversation about discrimination, because being a whistleblower essentially means that you are reporting an act that your company is doing or organization is doing that goes against public policy. So that could mean, for example, that your organization is using government money for something different than what it's intended. Or you're reporting that your organization that happens to be in healthcare is taking acts that go against patient health or patient safety, right? Those are types of things that might mean you're a whistleblower. Now, being a whistleblower sometimes is not, you're not always seen as a hero, particularly by your employer, but it is an important citizen duty that we should protect more. And recently in New York City, they have made it a lot easier for people to be a whistleblower at work. So for starters, you don't have to be a current employee of your employer to be a whistleblower. You can be a former employee. So they expanded the definition of what it means to be an employee protected under the law. Also, it used to be that you have to have concrete evidence that that the act that you are reporting against is actually happening, which is hard to do, right? How would you know for certain that your employer is engaging in some nefarious act if you don't have access to certain documents or you don't have access to certain people? Now, the law says that you just have to have reasonable suspicion, right? So you just have to have an inkling that something is happening, not that it's for sure happening, which helps tremendously, particularly if you know something's up, you can't quite put your finger on it, but you just know that you're seeing something happening that's bad, and that you want to at least report it, right? And let the authorities, try to get to the meat of the issue, right? And that's really important when it comes to protecting whistleblowers and instilling confidence that the system would, could work for them. Other things that are important to note with the new law is the fact that retaliatory action has been defined even more to be more expansive. So it used to be that it can only be a discharge or suspension or demotion would be considered retaliatory. But just the fact that your future employment might be impacted negatively for coming forward could be retaliatory. So think about, like, if you're in an industry and it comes out that you reported your former employer for doing something wrong, that employer could get you blacklisted in the industry, right? Now if you can prove that that's what they're doing, that is also now retaliatory and protect and enforced under the new New York City law. And one more thing I want to highlight with the law is that it used to be that you had to be within the scope of your job duties to do a report. So if, for example, you are a nurse and you're reporting that your hospital is not adhering to certain patient care laws in the city, you might be okay. But if you are a janitor who just happened to work in that unit, you may not be protected under the old law. But now that changes. So the nurse and the janitor are both protected equally under the new New York City law for whistleblowers.
Yeah. Before we go, I want to give an opportunity for our viewers to know a little bit more about how to get connected into your organization and if they want to get more information, the services that you provide.
Yeah, so our core mission is to provide the public on workers' rights laws around the country, including New York State and New York City. And so we have over 400 pages of Know Your Rights content that is in non-legal jargon that will help you understand your workplace rights in different areas, including, as we covered today, whistleblower protection and discrimination. And we're on all major social media platforms, so you can find us on Facebook, Instagram, Twitter, and YouTube. We also have a weekly newsletter that I encourage everyone to sign up for because we keep you updated on the latest news in workers' rights advocacy and what's happening in terms of employee rights. And also, we have a fantastic blog as well that we encourage you all to check out. So that's how you can find us on the internet.
Yeah. Well, I want to thank you so much for joining us, Edgar, and being with us and certainly providing some much needed information. I think that as we look into 2022, that we can honestly say that it really is starting to look more towards the year of the employee, more than it is towards the employer these days, which is pretty good because for so many times I think employees have gotten the short end of the stick in many ways.
Absolutely.
Yeah. Well, thank you so much for being with us, Edgar Jatu, our guest here, and want you to stay with us. We got more here on the Social Justice Forums. We have another guest coming up in a minute.
I'm an ex-drug dealer, and I'll be your sub today. Can you see anything different as a pill?
No.
You don't know?
Fentanyl is being mixed into everything now. There's only one thing that will save somebody's life. That is naloxone nasal spray.
Fentanyl, it's cheap, it's potent, and it's profitable.
Why would drug dealers put a lethal dose of fentanyl in drugs if they know it's so harmful?
Really just all about the money.
I just didn't realize that one pill could change your whole life.
More kids should know.
Fostering a pet for a friend or neighbor can keep families together. Learn more at petsandpeopletogether.org.
Every day, thousands of kids start vaping. And I can't let this happen to my kid. Of course, it's awkward to talk to your kids about the dangers of vaping. Hey, bestie, how sketch is me? It's hard to get their attention. Ready? Go. Yes, look at that. You even turn yours over. So if you want to talk to your kids about the dangers of vaping, you have to get it trending. Right, Backpack Kid?
Let's do it.
First, invite your kid to do the vape talk. Let's try this. All right.
Why is he here?
Yeah, I gotta get it trending, honey.
Come on. Let's go.
Oh, honey, can we talk?
Yeah, what's up?
I see a lot of your friends vaping.
Visit talkaboutvaping.org for tips on when and how to have the vape talk.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame. En
En esta casa, los hombres no lloran.
You all right?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
And welcome back to the show. The New York Safety Net Hospital Coalition was formed in response to the urgent need to structurally reform the outdated Medicaid reimbursement rates for safety net hospitals in New York. Now, the coalition seeks to bring an end to New York State's two-tiered healthcare system through transformative changes, modernizing and equalizing, Medicaid reimbursement rates, and then standardizing eligibility criteria and promoting hospital spending transparency. Joining us now is the president and CEO of the SBH Health System, David Perlstein. And David, good to have you.
Thank you, Daren. It's great to be here.
Well, thank you. It's a great conversation to have, and glad to have you sharing with us. And for somebody who may not be so familiar with the safety net, why don't you go ahead and take it away?
I absolutely will. And before I start, just so you understand kind of where I'm coming from, I'm a pediatrician by training. I've worked in the Bronx for 24 years now. I practiced in the Bronx up until about 3 years ago, right before COVID, actually. I stopped in 2019, and I've been the president and CEO of the hospital since 2016. So SBH is a safety net. And what a safety net hospital is, it's a mission-driven private or public anchor institution that's often located in historically marginalized communities of color. Such as the community that SBH serves, or St. Barnabas Hospital serves here in the Bronx. You know, our communities suffer from higher levels of poverty, primarily dependent on the Medicaid system to cover the cost of their medical care, which, as you mentioned, unfortunately, it does not, due to the fact that Medicaid only reimburses a portion of the full amount that safety net spend on providing that care. And that has put the entire system at risk for collapsing. The fact that our safety net hospitals are struggling to stay afloat due to this, what I would call an inequitable reimbursement system that has been exacerbated by significant underfunding for many years. And that's, you got to remember, Medicaid rates have been flat since 2008. So yeah, go ahead.
No, I'm sorry. No. I'll let you continue, and then I'll come back with my next question. I didn't want to cut you off. Go ahead.
So, and this is a really big deal. And if I talk about the collapse of the safety net system, because you got to remember, we have estimated, the Safety Net Coalition, that there are about 30 safety net hospitals in New York, serving about 5 million people, and accounting for nearly 2,500 inpatient beds and millions of emergency procedural and ambulatory visits. We're usually the largest employers in our communities, and we collectively employ over 40,000 New Yorkers and have significant economic impact on the neighborhoods. But we're struggling.
And so when we talk about the issues that these hospitals actually face and the struggle, give us a little bit more in depth so that way people can get a better perspective on this here.
Sure. So this chronic underfunding that we have is really due just to the structure of the way healthcare is paid for. You mentioned a two-tier system, and when we talk about a two-tier system, we talk about systems of healthcare that serve generally poor people, which is under the Medicaid system, and then the kind of systems that serve wealthier patients, I would say wealthier and wider patients, where commercial rates can cover whatever losses occur due to other patients being in the Medicaid system, which are not that many. We really do recognize that this underfunding results in basically margins that are just terrible and usually negative, and it as a result hinders our ability to make investments needed to operate, and it forces us to constantly reevaluate our ability to deliver the care that our community needs and deserves. And I'll say it again, I think it's not only disrespectful, but it's foundationally racist. And I say that because the folks that are in this other tier don't usually have issues. And that's because, commercial payers often will pay 7 or 8 times more what Medicaid covers. And by the way, their costs are not higher. I would argue that because we're in communities that have typically suffered from unmet social determinants of health, and we saw a lot of these issues arise during COVID, such as stable housing, access to high quality foods, better educational and employment opportunities, personal safety issues, which usually results and has resulted in higher rates of preventable diseases such as asthma and COPD and high blood pressure, obesity, diabetes, anxiety, depression, substance abuse, and even non-accidental trauma. And as you know, and I'm sure you are aware, the Bronx still is is ranked 62nd out of the 62 counties in New York State that are ranked in order of health, wellness, and longevity. And the idea is that the safety net should be better funded to collectively address the issues. And honestly, it makes no public health or economic sense that it's not.
I mean, what can we do by way of policy, Dr. Perlstein, about really bringing some equity here? Because certainly there's some ways that we can go about making things a little bit better.
Right. So I think there are quite a few things, and there are things that the safety net the Safety Net Coalition is trying to accomplish. But I'll tell you, even while we face financial challenges, and they're huge, we're still innovative, we're creative, we're impactful, we're mission driven. We just don't know how long we can keep it up. I will about a program that we're running right now at SBH, and that program is a wellness center. It's the photograph that I have on my screen. This is a result of a public and private partnership that we worked with a developer. We donated the land. They built 314 units of affordable housing that is full. We actually saved 95 of those units for formerly homeless individuals. And in exchange, we received a wellness space that's about a 50,000 square foot space that has women's and children's programs. And on the second, and urgent care, and on the second floor, it has like these amazing holistic services such as a fitness center and a teaching kitchen, community space, rooftop farms, exercise classes, and we're already seeing the impact. We've partnered with Bragg on violence interrupters, and we've been teaching boxing to a bunch of adolescents. We just hired actually one of those individuals who was involved in learning the boxing and now is teaching it. We have obesity management programs, and we've already have anecdotal evidence that our patients' BMIs, which is a measure of obesity, is dropping, and their diabetes are more under control. So we know we can do these fantastic things, but we need to get paid or have some sort of payment that actually covers the cost of doing transformative work. So, the solution is really to make sure that Medicaid more than covers the cost of running these kinds of programs. And again, COVID pulled back the curtain on the disparity. It's our communities that were hit harder than others. And our communities were already overburdened as it was, and now they're struggling to get back. And it's a challenge. So the Safety Net Coalition, and this is important, we got together after COVID. The Safety Net Coalition got together after COVID because we started working together during COVID because we were really challenged to make sure that we had the PPE and the supplies and the ventilators and places to send patients when we were full. So we worked closely together during that time, and after kind of the urgency of COVID fell back, we got together, I think it was originally 11 different institutions, all with the same challenges, got together to come up with a plan to fix this once and for all. And we believe that we have a way out of it. I will tell you that that New York State is making significant progress. The governor's office and the Department of Health are focused on this, and they're thinking about ways to improve the bottom lines at our institutions and make sure we have some capital, both for operations and equipment. But it doesn't come close to the Medicaid gap. It just doesn't. So our solution, and this is one of the things you were talking about, is to actually fix the structural payment inequity. And that means really working to reverse the years of underinvestment in our organizations and our collective organizations, and working with our partners at the state level to gain acceptance and approval.
I want to cut in because just for a second, because as you talk about this proposal, I know there's a proposal on the table. It proposes several things. I would love for our viewers to become a little bit more acquainted with what you're actually proposing, so that way they can get on board.
Absolutely, and I will tell you, healthcare financing is the most confusing thing on the face of the earth. And even if you talk to most physicians who are not in hospital management, they won't understand it. So first of all, the idea is that we need to educate more folks to understand what the challenges are. But we are really trying to see, we're working with the state, and we're working with the CMS, which is the Center for Medicare and Medicaid, to increase the Medicaid payments for certain populations. And right now there is a program called the Directed Payment Program, which is a program that New York State and the CMS work together on. And that gives a Medicaid add-on, so the Medicaid volume that you have for certain patients. Right now, there are 18 facilities that benefit. We believe that we need to expand that to all of the hospitals that are impacted as we are. And that would include both downstate and upstate. So the idea is to first expand the DPP program from 18 to 30 hospitals who care for a large number of Medicaid recipients, and we can stabilize the entire system just doing that. The second bullet point I would say is to tie the payments to average regional commercial rates. I already told you that we can't cross-subsidize with commercial rates the way the wealthier hospitals can. And we need to be able to make up that difference so we can pay our bills. And we also believe that if we can tie the payments to average commercial rates, then we can actually start to stabilize the operations, and we can make the necessary capital investments in the programs and services that the community actually needs. And I'm talking about preventive care, special populations, behavioral health, which traditionally are not, well paid. Our wellness center, we lose money on our wellness center. I will never stop delivering care in that space because I'm making more of a difference there than I make anywhere else. The third bullet point, go ahead.
I'm sorry, no, we talk about mental health and wellness. We know that's a huge issue, particularly in communities of color. Having those sort of resources there. When you talk about the borough of the Bronx, we know, the Not 62 campaign is out there. We know that there's a lot of challenges in terms of our health. But the one thing where I think everybody agrees is mental health doesn't get a fair play. And so for you, I heard you say it, you're going to continue that continuum of care, even though it may not get the maximum amount of support that you're looking for.
I am not in the business to make money, right? That's really the key thing here. For some reason, healthcare in the United States is on the same par as building televisions. And honestly, it shouldn't be. It should be funded the right way and for the right reasons to get the maximal social good out of the programs. And so we think that by taking advantage of available subsidies that are out there and available funds that are out there, we can really change the trajectory. We can fix the 62 thing. We can at least start to 6. And by the way, I mean, honestly, Daren, it's a long game, which is why it's so hard to make things happen. You're not going to fix this in a year, This is a problem that has been going on long before I got to the Bronx. And my sense is, if we can start making the investments, both in the Bronx and in Brooklyn and in areas of Queens and other areas of the state that are impacted the same way as I am, we can start helping our populations get out of these cycles. And that's what our job should be. We should be partnering with folks that have the expertise and the resources to assist us in this process. But healthcare organizations have to be at the forefront, recognizing our job is not just to admit patients and discharge them. Our job is to keep them out of the hospital, invest in the community in a way that will keep them healthier, control their anxiety, which usually leads to the depression and leads to the substance abuse and leads to non-accidental trauma and violence. I mean, we have so many opportunities to do that. And I will say that if we can get the federal government to put in more, and there is a way to do that, and we did meet with CMS and we've talked to New York State about this, there's a way to actually maximize the available use of federal funds and shift away from other programs such as the disproportionate share and vital access provider programs that the state can't get the matching funds on. So we believe also that by establishing this program, we could also work on establishing, reporting requirements that ensure, because you have to, that ensure the program is actually delivering what it promises, focusing on health equity, access, quality, experience, and operational efficiencies. We believe we should be moving forward towards value-based care. We should be really focusing on prevention and outcomes and not just pouring money down the drain. So we believe we're certainly positioned to lead, and we're hoping that the state and the legislatures recognizes that, and we really appreciate being able to come on here and at least spread the word.
Well, Dr. Perlstein, before we go, please give people an opportunity on letting them know how they can support the efforts and the things that you've got going on here.
I think that the best thing to do, and this is the power of a democracy, is that you reach out to your elected official and you basically talk about the importance of reinvesting or doing further investment in the safety nets, because we are the hospitals that take care of you. And if we don't exist, you lose the mission and you lose the focus that we have, which is to really be there consistently when nobody else is. So I would encourage everyone to learn that lesson early, because it's empowering, and your legislators will listen. Legislators need to be elected, as does the governor. So the more people out there speaking this truth, the better.
Well, Dr. Perlstein, I want to thank you so much for coming and sharing with us. I think it's a very important conversation to have, some much needed information. And thank you for the work with the Safety Net Hospital Coalition and all that's going on. Certainly we'll continue to keep our viewers up to date and let them know what's going on there. Thanks much.
Thanks so much, Daren.
All righty. Well, I want to let you know we're at the end of our show today. I want to definitely thank you. Hope that you enjoyed this week's discussion on the Social Justice Forum. Now, listen, we continue to up the conversation, more informative guests. You can catch Recablecast on BronxNet. Also, you can join us on social media. And then also, don't forget to hesitate, visit our social media, BronxNet TV. I'm Daren Jaime saying thank you for watching the Social Justice Forum. We'll talk to you soon.